If someone's out there looking for, getting a hair transplant done, I personally think there are a few criteria that they should look for, and I think it's very important. Now, whether it be with me or somebody else, it doesn't mean it has to be with me, okay? I think one of the first and foremost things that someone should look for when they're looking to get hair restoration done is that is all the surgeon does. Their practice, their specialty is hair restoration surgery. That's going to ensure a couple of things. One, that they've got enough experience to be able to pull that off. And two, they've got a stable staff that they can count on. Because this is a team game. You need to have a lot of people involved in pulling this together to make it work. So I think somebody exclusively practices in doing nothing but hair restoration surgery. To me, that's criteria number one. My other maybe a bias is I think that they should have a certification. I think they should have something that shows that they have been reviewed by their peers and shown to do appropriate good work. There's only one certifying agency out there, and that's the American Board of Hair Restoration Surgery. For me, I believe that's something that is a feather in the surgeon's cap, and you should look for that. Being a member of the ISHRS, or International Society of Hair Restoration Surgeons, that's great, but the board certification, or having that diplomacy, that diplomat of the American Board of Hair Restoration Surgeons, means that you have been vetted. It means that you have been reviewed. It means that you've been put through a rigorous oral examination. It means that you have been assessed by your peers for your work, and it means that you've passed a rigorous written exam. To me, I think that's important when you're looking to make a permanent change on somebody. So those are just a couple of things. And then ultimately it has to be what's convenient and right for you, what goes right in your gut. If you walk into somebody and it's too expensive or whatever the case may be, I often will tell patients, listen, don't do it. Don't do it. Wait until you can afford to do it right. Don't waste your money if it's just going to be done by the guy who opened up a shop and he brings technicians in. That's not what you want, and that's not what the best guys in the world are doing today. What the best guys and gals in the world doing this work are doing today, they're doing their work and they're loving their specialty. So that's my best advice to you as a consumer, and I hope it helps.